if we are going to have a public health impact on this disease, that is, if this disease involves 5.5 million people in this country at this point in time, and it's going to triple over the next several decades, we have to deal with this earlier in the process. That is, we cannot wait for people to develop symptoms and then treat them. It's like, I'll worry about your heart disease when you have a heart attack. No, no, no. We have to worry about your heart disease, your risk for heart disease, when your cholesterol's up, when your blood sugar's up, when your hypertension is present. That's when we're going to be concerned about your risk of developing heart disease. Well, same thing in Alzheimer's disease. As we design these risk profiles of people, maybe some genetic features, maybe some other biomarkers. Right now we've been focusing on imaging biomarkers, cerebrospinal fluid biomarkers, lumbar puncture. We may actually be able to detect these risks in the blood. So where the field is going is actually looking at these risk profiles in the blood. Can we develop blood tests to say whether you're going to have elevated amyloid, you're going to have elevated tau, or you have other biochemical features that may influence inflammatory processes in the brain? So I think it's quite possible that we will develop a panel of predictors of your risk for developing Alzheimer's disease based on some genetic features and perhaps some of these blood biomarkers that may give us a profile with regard to the underlying proteins that you're likely to develop later in life. The advantage of that protein profile, of course, is that hopefully we'll be able to develop individual therapies for those proteins. So if you have an elevated amyloid profile, we'll give you an amyloid drug. If you have an elevated tau protein, we'll give you a tau drug, but it could be TDP-43, it could be alpha-synuclein, it could be vascular disease, a whole variety of contributors to your clinical picture. And as we develop this profile, then we design combination therapy for you.
So the other key piece of research is really on the diagnostic pathway, because we do want to tailor and personalize the treatments in the future. And one of the ways to do that is to have really a timely diagnosis of where these proteins are going wrong and what are they causing. Again, we understand that for a given amount of disease in the brain, whether it's amyloid and tau combined, symptoms can be different. An individual can have a head full of amyloid and tau but not have neurodegeneration, for example, and not have symptoms. Or another individual can have relatively same age, etc., have the same amount of amyloid and tau and have neurodegeneration of a mild to moderate amount and not have symptoms still. So there are, again, these components of both cognitive reserve and brain reserve and vulnerability that we need to understand better. And one of the things in the future that's very exciting, along with the PET scans, for example, that are now available clinically, although insurance coverage is an issue. One of those methods is our amyloid PET scans, for example. And this was recently, just in the last month, a paper came out, a very important paper, came out in JAMA, from the IDEA study. And this was 18,000 individuals who were studied in the dementia subspecialty care setting with who were 65 and older. It was Medicare coverage with evidence development. And one of the aims of the study, that was really an effectiveness study in clinical practice, was to see in individuals who have symptoms, who've had some aspects of a workup, including some neuroimaging and some testing, whether when a dementia specialist is unsure about the etiology or cause, whether having these amyloid scans help change, for example, diagnosis and management. And the answer to that was overwhelmingly yes, actually. And dovetails with a study done in the Netherlands also, that actually knowing the etiology, the cause, is important. So the next part of the study is whether this is going to save money and how for the healthcare system, at least in the short term in over 12 months. But again, it goes back to having biomarkers, whether they're imaging studies or spinal fluid or hopefully from the blood. And I think over the next 5 to 7 years, we will have some biomarkers that are blood related with some sort of propensity scores that allow us to have a broader ability to detect sensitively people and then move them on to getting the more expensive and complicated biomarkers, let's say spinal fluid or PET scans. But in order to do that, we still need involvement from clinicians, from society, to go into these studies, because we have to have the correlation between, let's say, the blood and the spinal fluid and the PET scans, and even autopsy studies eventually. So people are actually donating, in some cases, their brains and bodies for these. So that's a very important pathway. The other pathway, I think, is prevention. And again, there's this Lancet study that came out. It was Lancet's commission, came out in 2017. I urge everybody to go read that. And it talks about both pathways of resilience and cognitive reserve, and how potentially somewhere between 30 to 35% of global dementia risk is potentially modifiable through the life course. Again, what is it that makes some individuals more resilient than others to damage in the brain? And we know early education, for example, certainly IQ, learning throughout one's life, mitigating cerebrovascular risk factors, including blood pressure, cholesterol, diabetes, metabolic syndrome. All those things are very, very important in midlife, and even in late life. Things like physical activity, exercise, social engagement, mental engagement, decreasing, for example, hearing loss, are very, very important in actually delaying the dementia symptoms, for example. So as part of that, there are a number of studies, both in Europe and now in the US, including, for example, what's called the US Pointer study, but there are others that suggest that we should be looking at multifactorial approaches, multiple, nutrition, physical activity and exercise, mitigating cerebrovascular risk factors, and again, social and mental engagement, and bundling together to see how that could actually affect the course of cognitive decline and dementia risk prevention. So those are going to be very, very important factors going along in the future.